Hello and welcome to the fourth video of our series on pediatric growth, development, and assessment. In this video, we'll be talking about the preschooler. As we mentioned before, the preschooler age group is in the 3 to 6 year range. Similar to the slowdown that we see in the toddler years, during the preschool years, physical growth is more slow and stable as well. The average weight gain is about 5 pounds a year, and body systems are pretty mature and stabilized by now. The child is really starting to master gross and fine motor skills. For gross motor, they should be walking, running, climbing, and jumping, and they should be doing that well and coordinatedly. For fine motor, they should get a refinement in eye-hand coordination as well as muscle coordination, and they should be skillful at manipulating small objects, such as getting dressed with buttons. According to Erickson's theory, the preschooler is developing a sense of initiative. As implied in the name, they're getting ready to go to school, but they still need to develop a little bit more conscience, moral development, as well as understanding what is expected from their behavior. Because they don't quite understand yet, it's common for them to get feelings of guilt, anxiety, and fear when things aren't going well. The major task for cognitive development is getting them ready for school and scholastic learning, and typically they attend school at 5 to 6 years of age. Similar to the toddler years, the preschool years are exciting for cognitive development. They start to shift away from everything being about them and having more social awareness and the ability to consider others' viewpoints. Their language and development of causal relationships continues to develop, and it's very common to see magical thinking. We should take that into account when we approach them in the clinical practice arena. As we said just a moment ago, moral development really starts now as well. They get a very concrete sense of justice and fairness during the preschool years. Body image continues to develop during the preschool years as well. They start to understand more of how it's desirable to look. They're more aware of racial identity, and they also have poorly defined body boundaries. For example, they think if someone is poked or if something is broken, all of their blood and insides will leak out. Sexuality also continues to develop during the preschool years. Children typically form a strong attachment to the opposite sex parent, and modesty for them becomes a concern. We need to take this into account when we're assessing them. We also need to realize that questions about sexual reproduction and sexual exploration is more pronounced. For social development in preschool years, separation and individualization continues to develop. We should see less stranger fear, fear of separation, and social anxiety. And for the kids who have persistent fears and anxieties, play therapy can be very beneficial. The preschool years are also important for language development. Language becomes far more sophisticated. That's also the main form of communication and social interaction. The vocabulary and complexity of language grows dramatically from the ages 2 to 5 years. As parents are often thankful to see, also under social development, we see less ritualism and negativism. The child wants to help out around the house, and they want to start dressing themselves. In the preschool years, we're going to see a transition away from parallel play to more associative play with other kids involving imagination and imaginary playmates and best friends. It's more dramatic, and there's more of a script that they make up. It's a lot more fun. While nutrition with preschoolers is less of a challenge than it was with toddlers, we still can see some food fads, and it's normal for them to vary greatly depending on the day how much food they eat. This typically coincides with periods of growth. We also need to start being very vigilant for childhood obesity at this age group. Preschoolers sleep about 12 hours per night. Unfortunately for the parents, they take infrequent naps. Waking up during the night is common, and kids can typically struggle with nightmares. For physical activity, preschoolers are very active. We can emphasize fun, but we also need to educate both the children and the parents about safety. Preschoolers are also ready to participate in group sports, and we should limit their screen time as much as possible. The American Academy of Pediatrics publishes their screen time recommendations every year. As we discussed earlier, dental health is very important for the preschooler. While they've got all of their baby teeth now, they need to get used to taking care of them because in the next age period, they're going to start getting their permanent teeth. Common concerns in the care of a preschooler include readiness for school, fears such as animals, large dogs, ghosts, stressors. Common family stressors include birth of a sibling, divorce, or relocation. And also speech problems. As we said earlier, the most critical period for developing speech is between 2 and 4 years of age. General anticipatory guidance for preschoolers and their parents include childcare shifting from protection to education. They need to have verbal explanations of how to avoid danger, such as never taking candy from a stranger. Children also begin questioning previous teachings of parents. They prefer their companionship of peers to their parents, and they also, as we all know, get ready to go to school. More anticipatory guidance for preschoolers include sleep problems, as we briefly mentioned earlier. Nightmares are common, and night terrors can happen as well. It's important to teach parents not to attempt to intervene with night terrors and that the episodes will be self-limited. Ritualism also helps with bedtime routines. Having a similar routine every night and avoiding any sort of intense physical activity right before bed can help get the child ready to go to sleep. Injury prevention is also important. Motor vehicle accidents, even motor versus pedestrian accidents. We need to include education concerning safety and potential hazards at home, but also provide appropriate protection for anything that the child is into, such as bicycle helmets or protective equipment for skateboards. The preschool period is also very commonly wrought with communicable diseases. Now, the incidence of these has reduced since we started immunizations, but it's still important to teach children to prevent the spread of communicable diseases with infection control practices, such as washing their hands at school and at home. We also need to teach the parents to keep their children home when they're sick. Common examples of communicable diseases in this age group include conjunctivitis or pink eye, viral upper respiratory infections, and gastroenteritis. Some of the physical exam differences in a preschooler than the younger ages include being able now to assess 6 cardinal fields of gaze. We also start having them do visual acuity and cover tests. We'll do the Weber and Rhine tests for their hearing, and we also need to start checking males for inguinal hernias. Thank you for your kind attention, and please continue to the 5th video of the series where we'll be talking about school-age children.